Hey y'all, what's up? It's your girl Danny again. If you're new here, welcome. If you're not new here, thanks for returning. So what I wanted to do in this video was discuss in detail in reference to what is a medical social worker in the hospital setting. I'll be discussing the details of the position as well as the pay and the pros and cons of the position. So, to tell a background story, I wasn't aware that there were any social workers in the hospital. Um, During my time of going to get the social work degree, I was just really under the impression of social workers being in the field of like child welfare, family situations, so like the court system, things of that nature, foster care, adoption, school system. And then I had become familiar with social workers working within the VA, right? Veterans. So I remember at the time I was working in the hospital as an insurance verification specialist. Um, and I would see this particular black girl. I never knew her name. She didn't know my name, but for some odd reason, we would just always speak to each other when we would walk by. And you would think we would know each other, right? And we'd be like, hey girl, stuff like that. Didn't even know each other's names. So I remember her, I believe she had attended my graduation at the time when I was graduating with my master's. I guess she had a family member that was also attending the same school and was graduating as well. So while she was at the graduation, I guess she heard my name called, seen me walk down, see me, walk and acknowledge my degree and things of that nature. So when I saw her at the hospital again, she was like, "Hey, I didn't know, you were going to school." And I was like, "Yeah." So at that time, that's when we exchanged, our name and stuff like that. And she was like, "I didn't know you was in the field of social work." And she was like, "I'm a social worker." And I was like, "You are?" Because I would always just see her walk around the hospital and be on different floors, and she would have on a white coat. And I had no idea. I kind of thought like either she worked in like pharmacy or something to that nature, right? So she was like, "I'm in the field. I'm a social worker." And I was like, "Is social workers here?" And she was like, "Yeah." I had no idea. And I believe a lot of people aren't aware of that unless you know somebody that works in the hospital, or if you become a patient of the hospital yourself, or if you like work in the field of like home health care or something to that nature, then you'll be aware that there's social workers at the hospital too. But I was like, "Is social workers here?" She was like, "Yeah, you should apply." And what's so crazy is at that time I had only applied for a position. I want to say it was like a family coordinator, some family service coordinator, something to that nature, where I would go into clients' homes, and just um, complete an assessment, and then at that point determine what services they could benefit from and interventions and things of that nature. And so at that time I had only applied for a position such as that, and during my interview, and also they had offered me the position. But of course, that's when I found out I would have needed to utilize my own car, my own vehicle. I would have needed to be on call every other weekend, and I'm like, on call, like I got kids. You know what I'm saying? Well, at that time I only had my son, but I was married. I didn't have my other two kids. But either way, I just was like, I'm a mom. I don't know about me being on call. I don't know about that. You know what I'm saying? So that didn't really work out for me. So yeah, just realizing that there's social workers in the hospital was like, what? Really? Wow. So anywho, let's get into the details now. So of course, you know me, I just kind of wrote down some things. So a hospital medical social worker provides non-medical support to patients and their families by helping them cope with the emotional, financial, and social challenges of illnesses and hospitalization. We act as patient advocates, assist with discharge planning, connect families with community resources, and provide counseling to help patients and families navigate navigate the healthcare system. So the the job duties of being a hospital social worker, which typically you're considered as the case manager. So within the case management department, there are social workers with MSW, master's degree in social work. You have some hospitals that do require you to be licensed. The hospital that I do work at does not require a license, but I believe in certain states maybe that's the case, but I'm not sure. So you either have, like I stated, master in social work, licensed clinical social workers, licensed medical social workers, or and then you will also have registered nurses. So I know, like at the hospital I work at, my head manager is master of social work. My assistant manager is a registered nurse, but is also a certified case manager. So what they try to do is on each floor they try to have two case managers, with one being a social worker and then the other case manager being a registered nurse. Some of the floors they got like that, and then some of the floors you have like two registered nurses, or either you will have two social workers. But I think they really balance out. Working when a social worker is working with a registered nurse as well, because we're I think they balance out because it's like registered nurses are more clinical, right? They understand how the side effects are, the effects of two different medications combining together, or sometimes they can better catch errors of doctor, recommendations, the doctor, medicines that the doctor recommends, or either the services the doctor recommends, or things of that nature. They're more so better able to catch any errors that the doctors may have made clinically wise. Then you have the social workers. I feel like we are a bit more empathetic. I feel like we show a bit more compassion than a registered nurse. That's just my opinion, my intake. We look more at the community resources. We look more at like the family support of things. I just think we balance out because we look at things differently in a sense, even though we both have the same primary goal, and that is to connect the patient with community resources and whatever services that they could benefit from once they discharge from the facility to prevent a readmission. But yeah, I think that just balances out. So yeah, that part is the detail of being a medical social worker in the hospital setting. So now let's get into the pay. So, a hospital medical social worker, the salary can typically range between 50,000 to 90,000 per year, and the average around like 74,000. But of course, that depends on your location, the hospital itself, benefits package. So you have some positions in other cities that may offer like a bonus. They may offer an additional raise within 3 months if you sign on, and just stuff like that. So it just really depends on the hospital itself, whether if it's like a nonprofit hospital type of hospital, or if it's a for-profit hospital. I think all those things just tie in together in reference to the pay. I know when I first started as a full-time employee, as a medical social worker in the hospital setting, my starting pay was 52,000. I didn't really at the time understand how to really properly negotiate, because I felt like, well, this was my first job as a social worker. This is my first job obtaining, after getting my social work degree. So that was my first job in the social work field, period. So I felt like that was pretty good. And also, comparing it to where I live, the price of living wasn't so expensive at that time, which was a couple years ago, not, of course. So I felt like 52,000 was relatively okay. But of course, once I got actually into the field and got into working as a hospital social worker, yeah, I was like, yeah, I should ask for more. Because it's really busy, it's really fast paced, it's really like doctors walking in and out all day, all day, all day. Even on your lunch break, sometimes you're taking your lunch at the desk, or either you're taking your lunch outside, but you still have the work phone because, oh my gosh, I was waiting for the doctor to put in a particular script so that I could send it to the home health care and have things finalized by 1:30, or whatever the case is, so that I could work on another task. So working in the field of healthcare is just really fast paced. It's really challenging being working at a slow pace and still getting things accomplished, still getting things done, still getting discharges moving because, once a patient is discharged is discharged off the floor and out their room, housekeeping comes in, sanitize the room, clean the room completely up, and then boom, they're moving a patient from the ER to that same room, like within a matter of a few hours, actually, or a matter of a couple of minutes, quite frankly. So, when you're working in the hospital setting, it's just really fast paced, and you just got to be prepared for that. You just got to, you know how to go with the flow, and sometimes a little faster than the flow. So, but other than that, it is a very rewarding position. So let's get into more so of the pros and cons, in my opinion, of being a medical social worker in the hospital setting. So the pros I think are networking, such as you learn the different community resources that's available, whether if it's the resources literally within the area or outside of the area that could assist. I think that just, networking and understanding, like I said, the different resources that's out there is a pro, because with those resources, you learn more so the resources that can not only help your patients, but could possibly help you in the future, help your family, a family member, a loved one, a neighbor that you may know that could benefit from those resources. So I think just working in the hospital setting, you have I want to say it, more of a, I can't think of the word right now, but you have, I don't know, I can't even think of the word, but you have a positive aspect to obtain and be aware of community resources. So I just think that's really a pro. Also, you being the connection to like other family members or of the patient, such as sometimes it's patients that come into the hospital and they're like, I don't have any family, I don't have anyone, I don't have any support, I don't have this, that, and the third. Maybe you could try to call my daughter and just see if she even cares. It'd be stuff like that. Like it'd be stuff like that you would hear, and it's like, wow. And then you would be like, well, do you have the contact number of your daughter? And they would be like, yeah, but she don't answer. Then you would call, say for instance, you would call that family member, and that family member would be like, they're in the hospital. What? I'm on the way. And it's like, wow, well, she's coming. And they'd be like, really? You would be so shocked at family dynamics. And I know I was, because I'm like, wow, it's really eye opening working in the hospital. I can't say working as a social worker, of course, but I think just working in a hospital in general, I think it's very eye opening. To a lot of things, whether if it's yourself individually, family members, your relationships, with family members or loved ones, or just like I stated previously, you being aware of just resources in your area. I think it's just very eye opening. So I think that is uh one of the pros of being a social worker in the hospital setting. Additionally, I think the flexibility of the job as well is a pro, because within the hospital doesn't close. You have certain departments within the hospital that closes. It has certain normal business operation hours or whatever, but the hospital in general doesn't close. So you have a lot of more flexibility in that type of in a position within the healthcare setting, period, and especially within the hospital. A con I would say would be the pay. I think the pay could be increased. Um, what is another con? I think maybe just the challenges of maybe, like I stated, the flow of things, maybe just moving fast. Because once you clock in at the hospital, sometimes you could barely be able to put your clipboard down at your desk, and a doctor is walking in or a nurse is walking in, and they're letting you know, hey, this patient will be clear today. This patient will be, I'm about to go around on this patient, but yesterday the patient was doing great. So I think I'm going to go ahead and clear the patient, and the patient needs XYZ for discharging. Boom. So right then, the doctor coming to you with 8:30 in the morning, say 9 o'clock in the morning, and they're going to expect to have that patient out of that hospital room at least by noon. I'm just going to be honest with you, and that might be actually pretty late. But other than that, especially like I know hospitals have like codes. It's like code. You're in either code green or code red of admission, and just things of that nature. And that's letting you know how busy the emergency room is. When the emergency room is busy, you need rooms on the floor available. So from that point, the ball is rolling. The ball is rolling. The moment you clock in, the ball is rolling. So I think, that's just a con. If you're unable to move at a very fast pace, it may just be challenging, especially with the social workers. We have to document everything. We have to notate everything. We have to scan everything in. We have to, properly have documentation. That's a very big deal of our degree, right? So I think that would be challenging if you're not if you don't have a proper flow going for yourself to keep yourself of course sane. But if you don't have a proper flow for yourself, you can find yourself being burnt out. You can find yourself overworking. So the goal is to work smart, not hard, right? So if you have a proper flow, then I think you can properly um, acknowledge the social work consult that the clinical team possibly have put in. From that point, you're able to go speak with the patient in a proper time, get an understanding of their living arrangements, their support at home, what's needed for you to properly discharge this patient to a safe placement, and then go from there and make sure that you're documenting everything in that patient's chart, because that's huge. Because not only are you familiar with your notes, but also people within the clinical care of that patient has to also read your notes. So you want your notes to be as detailed as possible, which can take time, right? So I just think that it would be a con if you don't have a proper flow. It just be challenging. Other than that, I think that's about it. That's about all that I want to talk about. If you have any, suggestions or something that you would like to throw out there in reference to your experience of being a medical social worker in the healthcare setting or in the hospital setting, in particular, then share them with us. That'd be great, and I will be looking forward to your comments. Chat with you later. Bye.